The weather we're going to have this weekend so nice. It's about to be sandal season like this. Today we're talking about the health of your feet.
So are your feet clean? I know it's a personal question, right?
But an important one.
And they may not be as clean as you think. That's why we're bringing in our medical expert, Dr. Payal Kohli. I've heard people debate, like, do they wash their feet in the shower? And I'm like, how do you not wash your feet? Some people think it just runs off.
Yeah, do you wash your feet actively in the shower?
Yes. Yes.
So this is a misconception. A lot of my patients tell me, oh, well, the water's running down my feet,
right,
so they're getting clean. It's really important. In fact, the CDC and the UK National Health Service both recommend that once a day we should be washing our feet with soap and water, and there's many reasons for that. And the main reason is because there's so many bacteria on our feet. In fact, there's more sweat glands on the bottom of our feet than anywhere else in the body, over 250,000 sweat glands. You know that in between our toes, it's moist, it's warm, it's dark, and so bacteria can really thrive there.
Are you a moist word
I don't know,
person?
that's just kind of gross hearing that.
Well,
so you got to get rid of all that bacteria, all that sweat. You got to make sure you inspect your feet as well every day for injuries, especially if you're diabetic or you have poor circulation or anything like that. And then removing those dead skin cells is really important to prevent calluses, prevent cracked heels. So it keeps our feet looking better, but also feeling better as well.
but I will say yes, and you scrub once a day in the shower, twice a day in the shower. But they do just get dirty again, especially in sandals. Like you're walking around the streets of Denver and I'm like, oh God, well, you know.
Yep, so that's an interesting question. So they looked at, they swabbed the feet of people who washed their feet and the feet of people who didn't. And if you don't wash your feet in the shower, as you're supposed to with soap and warm water, you had over 1 million bacteria concentrated into a little piece of skin. Whereas if you washed your feet, it was more like 8,800. So it reduces the amount of bacteria, which can, by the way, make your feet smell better too, because these bacteria make your feet smell, right? And it changes the types of bacteria. So we want to think about our feet just like we think about our gut. There are bacteria that live there, but the types of bacteria that live there really determine the health of our feet, our risk for infection, and then even how much odor we have from our feet as well.
Wow. Well, if you have boys or a teenage boy, you smell those shoes. Ew. I always worry about this, but I mean, my mom was like, we'd go to a hotel room. We weren't allowed to walk around barefoot in the hotel.
Or in the hotel shower.
I get that.
She never, ever in the shower. She was really a little obsessive. But part of it is like clean your feet then at night because you're getting into your sheets.
Yeah, so some people that take showers at night, in fact, they say even after you go to the gym, you should wash your feet after you exercise because you've sweated more on your feet. So it's really important to do that. And the way to wash your feet, there's a way to wash it. So soap and warm water, make sure you clean in between all of those toes. And then I never do this, but when you get out of the shower, you actually have to dry your feet with a towel, including in between your toes. I just kind of stand on the bath mat, wait for it to dry itself. And then when you're moisturizing your feet, if you have dry feet, do not put any lotion in between your toes, because then you're creating that environment again, that warm, moist environment where bacteria can thrive. So you really want to just the tops and the bottoms of the feet that you moisturize, but not in between your toes.
I have never in my life thought about that.
Yeah.
Putting the lotion between. Okay, good to know. This is all good stuff. Before we let you go, what about like older adults? Is that something that we need to be thinking about? Does it change as you age, your foot makeup?
Not your foot makeup, but the health of your feet because of your circulation. So as we get older, we develop conditions like diabetes, high blood pressure. We can also have neuropathies, trouble with the nerves on our feet, so we can injure our feet and get cracks and trauma more easily. Bad shoes, because we start to get bunions and such, those can act up. And then a lot of older people also have leaky veins. Varicose veins, venous insufficiency, which can cause the blood to pool in our feet and make them more susceptible to injury. So if you're older, you really need to check your feet every day. I say in general to avoid conditions like athlete's foot, especially if you have a teenage boy. You need to air out those shoes. You need to change your socks every single day. You can't repeat
no matter
socks,
what.
No matter what. And you need to exfoliate your feet once a week. So have some kind of a little scrubber or something, a soft one. I don't like those hard ones because they're a little bit too rough on the skin of the feet, but a soft scrubber to actually scrub off some of those dead skin cells. All of this really reduces your risk of infection. And you have no idea how many people I see in the office where the source of infection is the toes or their feet. They cut their nails incorrectly, or they've got nail fungus or something else that's really colonizing the rest of their skin.
It's serious. I mean, it's like we're like, ooh, but it's really serious stuff. So thank you.
We take our feet for granted, and they hold us up literally all day long. So
good point.
Give some love.
I'm going to go home and give a good scrub right now. Thank you, Dr. Kohli. You can always find more on Dr. Kohli's advice at 9news.com/Dr. Kohli.